Vetscan. Chapter number 9, Veterinary Public Health. Rainwater has solvent action on lead because of presence of free carbon dioxide. Free carbon dioxide reacts with lead or Pb, and the rainwater has the solvent action on that lead because rainwater has carbon dioxide, free carbon dioxide, and this free carbon dioxide reacts with lead. Which of the following is associated with soft water? Soft water causes decreased calcification of teeth. Treatment of hard water with slaked lime, or in Urdu it is known as chuna. Treatment of hard water with slaked lime results in temporary hardness due to magnesium. Slaked lime Treatment of hard water with slaked lime results in temporary hardness due to magnesium. Which of the following gets decomposed rapidly in presence of organic matter yielding nascent oxygen? Potassium permanganate gets decomposed rapidly in presence of organic matter and resulting nascent oxygen. Which of the following does not occur in animal excreta? Bacillus anthracis is not in animal excreta, as it is not it does not colonizes the gastrointestinal tract of healthy animals, whereas Clostridium, Salmonella, and Vibrio are the normal colonizers of the uh, gastrointestinal tract of animals, and they are the opportunistic pathogens. Natural light is beneficial as it is natural light plays important role in synthesis of vitamin D. Natural light has germicidal action, and natural light stimulates egg production in birds by it has linked with melatonin. Melatonin is secreted from the brain, part of the brain, not sure, I think pituitary gland, but not sure. Pineal gland. Pineal gland is linked with melatonin, and that pineal gland is linked, and that melatonin is secretion is linked with the light day length. The infectious agent may gain entrance to the body by all of above: ingestion, inhalation, inoculation through the skin. Inoculation, the example of inoculation through the skin is the uh, schistosoma. Schistosoma is a parasite that can even cross the intact skin. Brucella may also cross the intact skin. Which of the following is not an exciting cause of disease? Exciting cause or a direct cause or the main cause. Trauma is not the exciting or main or the direct cause of disease. Age, toxin, and bacteria, they are the exciting or main causes of the disease. Age, toxin, and bacteria. First foodborne virus reported was poliomyelitis. Poliomyelitis means the spinal cord inflammation. The literally poliomyelitis means the spinal cord inflammation, and it was the first foodborne virus reported. The etiological agent of poliomyelitis. All zoonotic viruses are essentially not foodborne. The zoonosis is not dependent or linked with food, or foodborne diseases are not, they have no relation with that the foodborne diseases are zoonotic or zoonotic diseases are foodborne. So all zoonotic viruses are essentially not foodborne, or we can say that the zoonotic diseases are not linked with foodborne diseases, or food is not linked with zoonosis. And any direct link or any the oncogenic foodborne viruses are bovine leukosis virus. Bovine leukosis virus is the oncogenic foodborne virus. Bovine leukosis virus, it causes the cancer in bovines, and it is by food. The most important widespread zoonotic foodborne disease is poliomyelitis. Poliomyelitis is the most important widespread foodborne disease, and poliomyelitis is also the first foodborne virus reported. And food for human viral infection, the minimum infectious dose is 10 raised to power 6 infectious particles per gram of food. 10 raised to power 6, the 10 raised to power 6 infective particles per gram of food is the minimum infectious dose for human viral infection. For maximum inactivation of viruses in meat foods, irradiation is the panacea means cure or the treatment or the solution. Irradiation is the ultimate solution if we want the maximum inactivation of viruses in foods, so the foods are irradiated. Which of the following disease is transmitted through milk? Brucellosis is spread through milk. And leprosy, AIDS, and scarlet fever are not the milk-borne diseases. Leprosy, scarlet fever, and AIDS are not the milk-borne diseases. Brucellosis is the milk-borne disease. The good preservative is a substance with any of the following properties: prevents deterioration of food. Good preservative prevents the deterioration of food. The worldwide spread of a disease through food is known as pandemic. Pandemic means that it spreads worldwide. As COVID-19, coronavirus infectious disease 19, is a pandemic disease. It has infected whole of the earth, whole of the world. Lactobacillus plantarum belongs to thermobacterium. Thermobacterium means they can survive temperature up to 110 degrees centigrade. Thermophiles or thermobacterium. Lactobacillus plantarum belongs to thermobacterium. Streptococcus lactis can be differentiated from Streptococcus cremoris by ammonia from arginine. Ammonia is converted in urea cycle. Ammonia is converted into urea, and arginine is required for that. Arginine helps in converting ammonia to urea. It is the urea cycle, and it is also linked with the differentiation of Streptococcus lactis with Streptococcus cremoris. Refrigeration is good method for preserving cultures because cold retards bacterial growth. The decreased temperature than that of the optimal temperature causes the retardation of bacterial growth. More temperature than the optimal also retards the bacterial growth. Bacterial growth is at its optimal temperature. Life behaves optimal at its optimal conditions of the temperature, pressure, etc. The common disease is transmitted through air is diphtheria. Diphtheria has the clinical signs as it causes the respiratory distress, it causes paralysis, it causes the heart failure. Common signs are the respiratory signs. The common disease transmitted through air is diphtheria. Diplococin is produced by S. cremoris. S. cremoris, we had also studied that Staphylococcus cremoris, Streptococcus cremoris, and Streptococcus lactis, they were differentiated by ammonia from arginine, as ammonia is converted to urea by arginine. So that Streptococcus cremoris, that was differentiated by ammonia to urea conversion from Streptococcus lactis, is also the also produces diplococin. Hardness of water is caused by all of them are responsible to create the hardness of water as bicarbonate, sulfates, and chlorides. Bicarbonates of calcium and magnesium, sulfates of calcium and magnesium, chlorides and nitrates of calcium in large amount. Large amount, it means that chloride, as the chloride and nitrate, calcium chloride and calcium nitrate in their decreased amount or less amount is not responsible for hardness of water, but increased amount of calcium chloride, calcium nitrate causes the hardness of water, and the calcium sulfate, magnesium sulfate, calcium bicarbonate, magnesium bicarbonate. The common thing is calcium and magnesium. The salts are the chemicals are the calcium and magnesium, whether they are in bicarbonate form, sulfate form, or chloride or nitrate form, they causes the hardness of water. 1 milli equivalent per liter of hardness produces 50 is iron is equal to 50 parts per million. Milli equivalent per liter, they are linked with hydrogen ion production, and 1 milli it is actually a neutralizing unit, that how much of a chemical or solution neutralizes the other solution. It is measured as milli equivalent per liter. 1 milli equivalent per liter of hardness producing iron is equal to 50 parts per million. A useful rule of thumb in providing proper lighting is that the illumination level should be 30 times higher than the level at which task can just be done. A useful rule of thumb in providing proper lighting is that the illumination level should be 30 times than that of the minimal time light that can be used to done that task. Phosphate test is able to detect all of above. Phosphate test can detect 1.5 degree centigrade drop in pasteurization temperature. Phosphate test can detect 5-minute shortening of holding time. Phosphate test can detect addition of 1% of raw milk. So phosphatase test can be used to detect addition of 1%, 0.1% raw material, 1.5 temperature, time, and temperature and time can be detected by that. Enzyme test, phosphatase test, the temperatures are the one and the percentage of raw milk. Three things are detected by phosphatase test. We can detect the temperature fluctuation, we can check the time fluctuation, we can check the adulteration of as the addition of 0.1% raw milk. Temperature, time, and raw milk addition can be checked. Temperature can be detected up to 1.5 degree centigrade to drop in pasteurization temperature. Time is the 5-minute shortening of holding time, and the addition of raw milk up to 0.1%, addition of 0.1% raw milk, and 5-minute shortening time. Degree temperature is the 1.5 degree centigrade drop in pasteurization time. Whirling hygrometer indicates that it will detect moisture, is an instrument used to measure atmospheric humidity or moisture. Whirling hygrometer measures atmospheric humidity. The average critical temperature of hen is 60 to 70 degrees centigrade. First day temperature of chick is 95 degrees centigrade, and at every day 5 degrees centigrade is decreased 95 80 95 80 not 95 90 85 80 75 70, and at 70 degree centigrade then it degree Fahrenheit, then it remains constant throughout its life of broiler. If it is broiler, then it will be 35 to 42 days. First temperature is 95 degree centigrade, and then it is decreased 5 degree centigrade every day, and it is fixed at 70 degree Fahrenheit. All the temperatures are in Fahrenheit. If I am saying centigrade, then sorry for that. Chemical oxygen demand test for water is done for estimating the amount of degradable organic matter. Chemical COD or chemical oxygen demand test of water is done for estimating the amount of degradable organic matter. Chemical oxygen demand detects degradable organic matter, and it is the test on water. COD detects degradable organic matter, which is related to primary treatment of sewage. Grit chamber is related with primary treatment, or the sewage is checked by grit chamber. Sewage is linked with grit chamber, which is related to primary treatment of sewage. Grit chamber. Rabies is caused by virus, rhabdovirus. It is bullet shaped virus, and it propagates through the nerves, so it affects nervous system. It is also called as hydrophobia. excessive amount hydrophobia in humans. Any infected animal do not have hydrophobia. It is the point to consider that infected humans have the hydrophobia. Clinical signs that they are unable to drink the water as they have the paralysis of the drinking system. I do not know which organ, pharynx or larynx, but the animal cannot drink due to paralysis of that. And the dogs can drink. The dog do not have the hydrophobic condition or clinical sign in rabies. Excessive amount of fluoride in drinking water causes interference in calcification of teeth, resulting in mottled teeth. Excessive amount or increased fluoride or fluorine in drinking water causes interference in calcification of teeth, or increased fluoride in water affects calcification. Milker's nodule is caused by a virus. Indolent fever in man is caused by bacteria. Which of the following is dye reduction test? Methyl blue reduction test is a dye reduction test. Inert bacteria are bacteria which produce no change in characteristic of milk. No change in character of milk is caused by inert bacteria. They are inert. They cannot affect the characteristic of milk or property of milk. National agencies on microbiological quality control of dairy products are FAO, Food and Agriculture Organization. It is of USA. American Public Health Association. It is also of USA. If they both are, then ISI do not know for which it stands for, but it is also the National Agency on Microbiological Control, Quality Control of Dairy Products. Pasteurization of milk by high temperature short time method, or HTST, high temperature short time. HTST, high temperature short time, is 72 degrees centigrade for 15 seconds, 71 to 72 degrees centigrade for 15 minutes. That is the high temperature short time. Which one of the following is a rapid platform test? Clot uncoiling test is the rapid platform test of checking the milk quality. Men suffer from hypervitaminosis of vitamin A when they consume the liver of polar bear. Polar bear liver is rich with vitamin A. Anyone who suffer that, who eat that liver, may have the hypervitaminosis of vitamin A. During postmortem examination of lung, which lymph node is examined? Mediastinal lymph node. Mediastinal lymph nodes are checked as mesenteric. Name indicates it will be on mesentery. Mesentery is layer intestine, so mesenteric lymph nodes are in intestine. Portal lymph nodes, they should be at a circulatory system. Submaxillary, maxilla indicates brain, it should be near the skull. Submaxillary lymph nodes are in skull. Mesenteric lymph nodes are in intestine. Mediastinal lymph nodes are in lungs, so they should be detected during lung examination. The spores of anthrax organism are formed in presence of free oxygen. If there is free oxygen, then it leads to the formation of spores by Bacillus anthracis. Brucellosis can involve persons engaged with milk, meat, leather, and if any personnel is linked with any product or byproduct or the product of the infected animal, then he is susceptible for brucellosis. The presence of Streptococcus faecalis in drinking water suggests fecal contamination of water. Fecal contamination of water. Water is infected with the fecal feces, as the Streptococcus feces is secreted in feces, and these feces, infected feces, are contaminating with water, so the water has the presence of Streptococcus faecalis. Chemical which is most commonly used for water purification is bleaching powder. Bleaching powder is commonly used to purify the water. Pasteurization kills all the life. All organisms are killed in pasteurization, but some are not killed. Pasteurization do not kill whole of the life. There are some bacteria or some organisms that are thermoduric organisms. Thermoduric organisms are not killed with that, even with pasteurization. And the examples of thermoduric are Bacillus and Clostridium to some extent. Bacillus and Clostridium can undergo, or they can tolerate the pasteurization, so they are called as thermoduric organisms. Thermoduric bacteria or organisms, they can tolerate pasteurization. They can survive pasteurization. Ventilation in animal houses depends on both as temperature inside the room and velocity outside the room. Temperature inside shed, velocity of wind outside the shed. Both affects the ventilation in animal houses. Correct method to dispose the solid refuse from animal houses. Both of above, we can do the manure preparation and we can convert it into energy as biofuel. So both are the methods of, to dispose the solid refuse or solid manure of animal houses from animal houses. Germicidal infection effect of direct sunlight is mainly due to ultraviolet rays. The ultraviolet rays are the same rays that we use to detect DNA on agarose and gel. Bacterial flora of spray dried milk is a specialized one and predominantly consists of thermoduric. Thermoduric means that they can tolerate temperature to very much extent and they can tolerate even the pasteurization. So the bacterial flora of spray dried milk, if the milk is the dry milk which is of the form of spray dried milk, it has the spray bacterial flora and that predominates with the thermoduric bacteria. Trematol in milk is destroyed slowly by boiling. Trematol is not destroyed very rapidly, it is destroyed rapidly, slowly by boiling. Rubber get destroyed through the action of fat. Rubber get destroyed through the action of fat. Platform test for milk consists of acidity test, alcohol test and 10-minute Raycesarin test. These are the types of platform tests for milk: acidity test, alcohol test and 10-minute Raycesarin test. Retard, removable intestinal tie, adult rabbit diarrhea. It is a disease, I think. Removable intestinal tie, adult rabbit diarrhea. Retard, removable intestinal tie, adult rabbit diarrhea. Method has been successfully used with the Campylobacterium jejuni. Campylobacterium jejuni can be detected by retard of rabbits diarrheal disease and it is by the Campylobacter jejuni. Deposition of strontium 90 in the bone is more related to the content of potassium in diet. Potassium is causes the deposition of strontium 90 in the bone. Potassium is a constituent of DCP, so more DCP or abnormal DCP can lead to the deposition of strontium 90 in bone. In dairy products, critical control point include all of these as temperature control and time. The time of the control of temperature, time, environment, personal employee personal hygiene and inspection and monitoring of income materials. All these are involved in the dairy products critical control point evaluation. Raycesarin is a redox indicator and pH indicator. Raycesarin indicates oxidation reduction test and also the pH. It can be used as pH indicator. Remember that pH indicator in undergraduate we are commonly studied phenolphthalein. So now here is the Raycesarin test. It is the pH indicator and a redox indicator. In the production of safe processed dairy products, the major area of concern are all of these are the area of major concern in the production of safe processed dairy products as following: ingredients and time lag, procession methods, post processing contamination, ingredients, time lag, processing methods and post processing contamination. HACCP or Hazard Analysis Critical Control Point includes risk analysis of food, determination of critical control point, assessment of abuse of finished product. All are included in HACCP as risk analysis of food, determination of critical control point, and assessment of abuse of or abnormal use or the contamination of finished product. Dairy equipment is classed as well cleaned. Daily equipment is well cleaned if the surface count is less than 200. 200 surface count having less than 200 in the equipments, then these dairy equipments will be classed as well cleaned. Orthotolidine test enable to determine both A and C as combined choline only and free choline. Free choline and combined choline can be detected by orthotolidine test. Orthotolidine test determines or detects chlorine, binded or free formed, both. Orthotolidine test, it detects the combined chlorine and free chlorine. Particles of given virus type contain virus can have the genetic material at DNA or RNA, but not the both. Virus of poliomyelitis, a foodborne virus, is milk-borne viral infection. Poliomyelitis or polio is a milk-borne food infection. Poliomyelitis mean inflammation of is the inflammation of spinal cord. Hepatitis is a both A and B waterborne and foodborne disease. Hepatitis can be spread by water and food. Interferons are non-specific, they are antiviral. Non-specific antiviral agents. Interferons are the agents responsible for resistance for some of the viral infection, but these are not specific in nature. Tick-borne encephalitis disease is transmitted by milk and ticks. Tick-borne name indicates that it is tick-borne, but it can be spread by milk too. During heat inactivation, an important constituent protecting virus from heat in cream is fat. Fat is favoring the virus as it is protecting the virus from heat in cream. The fat of cream protects the virus from heat. So the virus is protected from heat inactivation. Introduction of virus to foodstuff after the event of harvest or slaughter is secondary contamination. Secondary contamination is the introduction or the contamination of virus to foodstuff after the event of harvest or slaughter. Inactivation of more deeply situated virus in food is possible by ionizing radiation. Ionizing radiation can even kill the more deep viruses. Inactivation of viruses within the substance of number of foods is enhanced by acidity. Acidity can inactivate the virus within the substance of number of foods, or simply acidity can inactivate viruses. Inactivation of food viruses take place effectively by freeze drying. Freeze drying can inactivate viruses, but the viruses can be reactivated when we let the freeze dried material to be thawed, and the virus is freeze dried virus, if it is lyophilized or its moisture is removed, then the viral shelf life is increased very much, and this is applied while formulating the freeze dried vaccines. In freeze dried vaccines, the viruses are lyophilized or their water content is removed. The virus is in dried form, so it is stored in freeze dried condition and its shelf life is increased, but it remains the it will give the immunity if any animal is vaccinated with this freezed dried lyophilized virus. uh, an example of this type of vaccine is the Newcastle disease. There is also a Newcastle freeze dried vaccine. Enteroviruses consists of RNA. The viruses that infect gastrointestinal tract are RNA viruses. The common viruses of RNA of veterinary importance that has many diseases I remember are the orthomyxoviridae and paramyxoviridae. Food products of infected animal origin are most likely to be contaminated within the deep tissues. Food products of infected animal origin are mostly likely to be contaminated within the deep tissues. Animal origins contamination is in deep tissues. Animal origin feed animal origin food is deeply contaminated. Inactivation of viruses is appreciably slowed down at below ambient temperature or below optimal temperature. Inactivation of viruses is appreciably slowed. The virus's inactivation is decreased at below ambient temperature. In chemical inactivation of virus is enhanced by oxidizing agents. Oxidizing agents are used for inactivation of viruses in chemical inactivation. Chemical inactivation name indicate that chemicals will be used, any oxidizing reducing agent will be used, but oxidizing agent is used to inactivate the virus. Cumulative poison which accumulates in body in animal body are all of above as arsenic, mercury and lead. Arsenic, mercury and lead are the cumulative poison which can accumulate in animal body. Entry of exotic diseases in the animal population is prevented by quarantine. Quarantine is a way to prevent the entry of exotic diseases in a farm. Wall windows in animal houses serve for lighting and ventilation. Wall windows can act as the lighting and ventilation management tool. Q fever in animal is caused by bacteria. Water which can dissolve the metal lead or Pb is called as plumbo solvent. Water which can dissolve plumb Pb is called as plumbo solvent, or to dissolve the plumb Pb. Milk ring test is used to diagnose a brucella. Full name of MPN is most probable number. Deficiency of iodine in water causes Goiter-Jones disease of bovines is caused by bacteria, mycobacteria. Paratuberculosis Jones disease, also known as Mycobacterium paratuberculosis, because it is caused by that bacteria. Irregular fever, insomnia, chill, sweating and joint pain. Joint pain indicates it's brucella. Brucellosis has the biphasic fever, joint pain and irregular fever. The nucleic acid in rabies virus is RNA. Ribonucleic acid is the virus of Rhabdoviridae. Rabies is caused by Rhabdoviridae family, Rhabdovirus. Mycobacteria tuberculosis. The question is, Malta fever in human is caused by Brucella melitensis. Brucellosis is also known as Malta fever in humans. Mammalian test is employed for the diagnosis of glanders. Glanders is diagnosed by Mammalian test. Streptococcus is amphizoonosis. Amphizoonosis means amphi mean both. Zoonosis mean that it can be zoonotic. It means that Both animals and humans both can infect each other, or infected human can infect the normal human, and and the infected human can infect the normal or uninfected animal. Anthro means related to human behavior, or as the anthropology means the study of human behavior, so anthro means related to human. First option as anthropozoonosis. The first part is the infected, the animal or human that will be infected, as not the normal host. The second part means that it is the final host or the predilected host, or that is infected usually. So anthropozoonosis means that humans are infected. Anthropozoonosis from humans, as the first word used is the anthro mean humans are infected by the animals. And zooanthropozoonosis means zoo mean animals are infected by anthro or humans. Zooanthropognosis means anthro mean humans are infected, and they infect the first part of the this world as zoo. And anthropognosis means the first word is human, and humans are infected by the animals. And amphi means both, that both can infect each other. Echinococcus granulosus, a cause of hydatid disease, is a cystode parasite, cystode or tapeworm. Echinococcus granulosus is a tapeworm that causes hydatid disease or forms the cysts. Causative agent of swimming pool granulomonas. Mycobacterium Mycobacterium tuberculosis or TB. TB causes the swimming pool granuloma. Brucella abortus cannot infect through intact skin. There are very less agents that can pass the intact skin. As example is the schistosoma, but brucella, it is not the case with brucella that it can cross the intact skin. Brucella cannot cross the intact skin. Infection with street virus of rabies produced Negri bodies. Negri bodies are the inclusion bodies that are used as diagnostic pointer for rabies in the neurons. Rabies virus is likely to infect those who occupied with animal product manufacture, as it is the disease of animals, so animal dealing personals can be infected with that. So rabies virus is likely to be infected with animal product manufacturers or personals. Cases carcass yield is also known as dressing out percentage. Dressing out percentage is also called as the carcass yield, and the carcass yield in cattle denotes the weight of the two sides of the beef, including kidney and head, but minus skin, blood, fat, and viscera, as skin, blood, fat, and viscera is not edible. Kidney is also not preferred to be eaten in South Asian countries, but the kidney is included within the carcass yield along with the head. Castration of male animal for meat purpose is preferred to avoid the dark flesh, to make them more manageable, to avoid dark flesh, and also the taste is good of the castrated animals. It is preferred to the meat of castrated animals is preferred due to its non dark flesh and good odor, and to make them animals are more manageable if they are castrated. Pigs prior to slaughter are made unconscious by passing through tunnel containing 65% carbon dioxide in oxygen gas. Prior to slaughtering, pigs are passed through 65% carbon dioxide in oxygen gas, and that is the very painful way of making the animals unconscious. And there are many animal right authorities who force the animal housekeepers not to use these techniques, as they are very painful, but they are being practiced to make them unconscious, and they advocate that it makes them unconscious, and so they can bypass the pain. The animal can bypass the pain of the slaughtering, so they have to tolerate that pain of being passed from 65% carbon dioxide in oxygen gas. Pepsin is produced from which of the following? Stomach produces pepsin to digest the protein. Viruses in food may be inactivated by all of the methods. Physical method as heat, many chemicals are used, and biological methods, they can be used to inactivate the virus. Virus of hepatitis A is carried by mechanical vector. Mechanical vector can pass the hepatitis A virus. Viruses of hepatitis A is carried by mechanical vector. Food and water, the indirect means of virus transmission, they are known as vehicles. Food and water are the vehicles, they are categorized as vehicle of transmission, of disease transmission. Tendency of a virus to localize in alternate tissues later in the course of infection is secondary tropism. Secondary tropism is the tendency of a virus to localize in an alternative tissue later in the course of infection. Radiation is not an ideal method for the inactivation of foodborne viruses because organoleptic changes are produced by radiation. So the radiation are not the ideal method of inactivation of foodborne viruses. Radiation kill all of the pathogens, and they are not most commonly used because it activates or it results in the organoleptic changes, change in taste, change in color, etc. Contamination of food by human carrier falls under secondary contamination. The food contamination by human carrier is secondary contamination, as the milkers or the farm workers, if they are contaminating the milk or the food, then it is the secondary contamination. Odor and flavor of different meats is influenced by fat. Fat is responsible for influencing the odor and flavor of different meats. The yield of total byproducts from meat is about 50%. Carcass yield is 50%, or marbling. No, it is not the marbling percentage. Marbling percentage is of fat. So the yield of total byproducts from meat animal is 50% of live weight. It means that half of the body weight, live body weight, is the edible or is the meat, and the remaining 50% is non-edible, as the bones and the non-edible viscera. During chilling, the meat is held in good condition without destroying the bloom when stored at minus 1.5 degree centigrade to 4.5 degree centigrade, or simple minus 1 to minus 4 degree centigrade is the chilling temperature in which meat is stored, and it is optimal temperature to store the meat or chill the meat, because at that the meat do not there is no effect in the destruction of bloom, or there is optimal bloom, or the bloom is retained to its optimal value when it is stored at minus 1.5 to minus 1.5 to 4.5 degrees centigrade. To provide efficient natural and artificial light, the following intensity of light is to be provided for general use and at place of inspection. It is related to postmortem inspection, and it is commonly known that 15 to 20 foot candle is the light that is required for postmortem for inspection, etc. Preferably the inspection is done at the sunlight, or if artificial light is required, then it should have the minimum or minimal of 20 foot candle power for general and 50 foot candle for power for inspection. For inspection, 50 foot candle should be the minimal intensity of light. The primary treatment of abattoir effluent consists of all of above, as screening out solids, removing fat either by hand or grease traps, and mechanical skimming of dissolved air flotation. Mechanical skimming of dissolved air flotation, removing fat either by hand or grease traps, and screening out solids are the primary treatment required for the primary treatment of abattoir effluents. The method of slaughter is designed to permit complete bleeding. Slaughtering should have the point that it should permit the complete bleeding. It should permit the unnecessary suffering of animal. So before slaughter, also the animal is as the pigs, they are passed through carbon dioxide chamber, so that their pain in slaughtering is they do not may not feel the pain of slaughtering. So there are also some methods that are used to bypass the pain of slaughter, but the slaughtering method should permit complete bleeding. They should permit unnecessary suffering. Slaughtering method is designed permit unnecessary suffering to animal. The extract of that should be that the animal should not have the unnecessary suffering. It should have to suffer as minimal as possible, and for the benefit of butchers. So, the butcher should it should also be the safe for the butchers. For example, if the animal is most probably has the chances that is infected from any disease, then butcher should not have that disease, should not take that disease by the blood or slaughtering method. And the method should not be there in a way that the animal become aggressive and it may kill or it may hit the butcher and butcher is injured. So the animal is properly restrained, and it is slaughtered in a way that the animal should not have the pain, and the butcher can easily slaughter that animal. Carcass of an animal recovered from contagious pneumonia may be passed for human consumption. It is passed for human consumption because the animal is recovered from that disease. The animal has the immunity, so the animal is not dangerous at that condition. If an animal has been recovered from any diseases, contagious pneumonia, so the animal is passed to be consumed by the human, but their lungs and their pleura is discarded. Pleura is discarded. Pleura is not edible, but the lungs are also condemned. East African man and apes are resistant to yellow fever. While Americans visiting the East Africa are suffered from that disease, of yellow fever. If the Americans visit the East Africa, they are suffered from yellow fever. But the East African men and apes, and they are not infected by yellow fever. Why? Because the East African men the population of the East African men is resistant to that disease, and they had been selected through natural selection. That nature has selected the humans and apes who can resist or who can tolerate the virus. But as the Americans, they are not exposed to virus, so any person from outside the East Africa, if he or she visits the Africa, then no one knows that his or her genetics is capable to fight with that virus, or is not capable. So but if the cases of our East African men, they all are the persons who are selected by nature to be to overcome that disease of yellow fever. Increased incidence of fox rabies in Europe is due to increased number of fox and increased number of mice, as the fox eats mice. So the increased number of mice has increased the number of foxes, so they may both be the reasons for the increased number of rabies in fox. Rabies may be due to the increased population density of fox and increased population density of mouse with which the fox eats. Increased mice or increased fox, the both may be the reason for the increased intensity of rabies in fox. Infectious agents capable of infecting only one species of host are called monophagous. The epidemiology of leishmaniasis is characterized by the following. It spreads by sandfly, and sandflies ingest macrophages containing leishman donovan bodies with its blood meal. Prevent measures are directed against adult sandflies. The leishmania in a nutshell is that it is a protozoal disease and it is intracellular parasite. The cell that is infected are the macrophages, intracellular or intramacrophagic parasite. And there are two main forms of leishmaniasis: cutaneous and visceral. Cutaneous and visceral forms, they are the main types of leishmania. Vector is also involved in this disease. The vector is blood sucking sandfly, and the host are, there are two main hosts, humans and the dogs. It is, in fact, it can be transmitted from human to the dogs or dogs to the humans through the, with the help of blood sucking vector, the sand fly. The main species involved in this disease are the Leishmania donovani, then donovani or donovani, that is famous for its disease, the Kala Azar. Causing the Kala Azar caused by Leishmania donovani, it causes the visceral leishmaniasis. And other species are the Leishmania tropica, that causes cutaneous leishmaniasis. Visceral leishmaniasis is also known as the Kala Azar, that is caused by Leishmania donovani, and the cutaneous leishmaniasis is caused by Leishmania tropica. Another species is the Leishmania brasiliensis. They are the three main types of the Leishmania: tropica, donovani, and brasiliensis. And distribution, it is distributed approximately throughout the world. But the major countries are the Asia, Africa, South Europe, and Mediterranean countries. And the clinical signs are mainly, sign and symptoms are the hemolytic anemia. It presents hemolytic anemia, and its incubation period, or the time difference between the infection to the clinical signs, can be up to years, from months to years. And dog is the main animal infected with that disease. And the clinical signs are the ulcers, skin ulcers on the visual form. Skin ulcers can be can be seen in the lip or the eyelids. And dogs that has the loss of body hair, they may also be checked for the leishmania infection. And there is also the eczema. Eczema means the lesions on, there is a type, it is the type of lesions on the skin. Loss of body hair, eczema. They, and cachexia or cachexia means severe body weight loss. Decreased in body weight is known as cachexia or cachexia. There is anemia, intermittent fever. Intermittent fever is also in brucellosis in humans. Loss of body hair, and eczema. The lesions on the skin. And how it is diagnosed? It is leishmania is diagnosed by smears and scrapings of the skin. Smears and scrapings is used to demonstrate the amestic form of the leishmania. And the treatment in animals like dogs, it is not treated because it has public health importance, whereas the humans are treated with the antimalarial compounds, as the allopurinol is used to treat the humans, but the dogs are not treated with that drug or any other drug, and they are recommended to be destroyed, culled, or killed. The disease can be controlled by the controlling sand flies, that are the vectors, and the vectors that can infect from human to human, dog to dog, and human to dogs. So they should have to be controlled, and from the destruction of and the killing of infected dogs is also the way to control the leishmaniasis. So from this information we can say that all the options are correct, as it spreads by sandflies. Sandflies ingest macrophages containing leishmania donovan bodies with its blood meal, and preventive measures are directed against the adult sandflies and the dogs too, with public health perspective point of view. In brucella vaccinated herds, the level of bovine brucellosis can be determined by a combination of serum agglutination test and a Rivanol precipitation test. Rivanol precipitation test is also a test to diagnose a brucellosis. It is also serum based test, serological test. The blood constitutes the group of important occupational. The following constitute the group of important occupational zoonosis. All of these have the zoonotic importance, as anthrax, trypanosomiasis, psittacosis, rabies, leptospirosis, typhus, brucellosis, leptospirosis, salmonellosis. All of them have the zoonotic importance. All are correct. Prolonged use of low doses of following antibiotic can lead to discoloration of teeth and retarded skeletal growth. It's tetracycline, especially in childs. In childs, tetracycline should not have to be used for very long duration, as it directly targets the bones, discolor teeth, and it may lead to the retarded skeletal growth. The FAD, World Health Organization Reference Center for Brucellosis, is located in one of the reference center for brucellosis is in Indian Veterinary Research Institute of Bareilly, city of Bareilly. The amplifying reservoir host for Japanese encephalitis are swine. Biological vectors of disease are of which types? All of the types are the examples of biological vectors as propagative, cyclopropagative, and developmental. They are the types of biological vectors of types of the biological vectors as propagative, cyclopropagative, and developmental. The etiological agent of tuberculosis TB was discovered by Robert Koch in 1882, approximately 20 years after the establishment of major institutes or educational institutes in subcontinent, as the Sadri Egerton College in Bahawalpur, King Edward School of Medicine in Lahore, and other colleges also. Swine are highly susceptible to the elementary infection of tuberculosis with bovine and avian types. Swine are highly susceptible to elementary infection of tuberculosis with bovine and avian types. Among domestic animals, tularemia is widely spread in sheep. Tularemia is a bacterial disease that is caused by Francisella tularensis, and it is the disease of rabbits, and it can be spread to humans too. And tularemia does not infect ruminants, and only sheep are reported to be infected with that disease. All other animals, all other ruminants, there is no report of the infection of other ruminants as the cattle, buffalo, or goats to be infected with the tularemia. Infectious agents capable of infecting only one species of host are called monophagous. Mono mean one, or single; phagous mean eater. Monophagous, single eater, or eat only one thing. So the infection eat only one thing or infect only one. So as it is infecting only one species, so it is known as the monophagous. Monophagous are the infectious agents that are capable of infecting only one species of host. Infection chains involving direct transmission between different vertebrates only are known as Homonomous means that an infectious agent has the capability to infect different vertebrates. It does not include the infection that is from between different species of vertebrates. Uh, it means that the infectious agent is infecting different vertebrate species, and if the infectious agent is transferring from one vertebrate species to another vertebrate species, then the term will be different. We have to remember that homonomous means that infection is the infectious agent is capable to infect different species, and the other is infection transmitted between one vertebrate species only is called homogeneous homonomous. It means that an infectious agent is capable to infect only one species. If it is capable to infect only one species, then it will be homogeneous homonomous, and if it is capable to infect different vertebrate species, then it will be homonomous only. But if the infectious agent is capable to infect different vertebrate species and between vertebrate species, then it will be the homogeneous heteronomous. Infections transmitted between different vertebrate species are the homogeneous heteronomous. These are the little bit confusing terms. First one is that the infectious agent is only infecting vertebrates. Directly infectious agent is infecting homonomous, and if it is infecting only one species, one vertebrate species, then it will be the homogeneous homonomous. But if it is infecting the different species, and infection agent is not infecting different species, the infected animals are transmitting or transferring their disease agents to other vertebrates, then it will be the homogeneous heteronomous. Infection requiring invertebrate vectors, if there is involvement of vectors, invertebrate vectors, then it will be the heteronomous. Infections requiring invertebrate vectors for transmission to vertebrates are known as, or simply if a vector is required for the transmission of disease to the vertebrates, if the vertebrates are being infected with a causative agent that is involving vector, example as Babesia is transmitted by a vector, then invertebrate vector, then it will be the heteronomous disease. Babesia is an heteronomous disease. Sternay spore vaccine. Sternay is a strain of anthrax that is used in anthrax spore vaccine. The Sternay spore vaccine is prepared from non-capsulating a virulent strain of Bacillus anthracis. It is the disease of livestock. It is the vaccine of livestock. Almost all animals are vaccinated against anthrax, and the vaccine that is available is the vaccine prepared by Veterinary Research Institute Lahore, but their details were not given, so we can be aware with the points of that vaccine. It is being prepared by European countries. The name of vaccine is anthrax spore vaccine, and the preparator or the man who is preparing that disease is Colorado Serum. And what are the properties? Bacillus anthracis protection for horses and livestock. It can be used in livestock as cattle, sheep, buffalo, and also equines as horses, and it protects against anthrax. It is used to protect anthrax. It is modified live vaccine, and it should not be vaccinated to the animals who will have to be slaughtered within 2 months. So it should have to be vaccinated to only the animals that are not to be slaughtered. The amount of a price of that vaccine is $1 per dose by thumb rule, or Pakistani rupees 150. It is expensive than that of the vaccine that is being prepared by Veterinary Research Institute Lahore. Pakistan usually vaccinated animals by the vaccine that is being prepared by VRI Lahore, Punjab vaccinate against that. And the details that are written on the bottle of the vaccine is the name is anthrax spore vaccine, and it is a non-encapsulated live culture. The strain used is Sternet strain 34F2. The name of the strain that is used in the anthrax spore vaccine is the Sternet strain 34F2, and it is non-encapsulated live culture. The animals that can be vaccinated are the healthy cattle, sheep, goat, swine, and horses. And direction, it should be stored, all the vaccines should have to be stored at 2 to 7 degrees centigrade, and they should not have to be freezed. And the precautions, they should not have to be subjected to the heat, autoclave, or chemicals, etc. In the event, dosage and administration dose is usually 1 ml subcut per animal, and it is vaccinated in revaccinated. It means that booster dose is also applied 2 to 3 weeks in heavily contaminated areas. If an area is heavily contaminated with anthrax, as there are some areas of Balochistan, also Cholistan also reports to have the outbreaks of anthrax. So these areas, as the Balochistan and the Cholistan, they should have to be booster vaccinated after 2 to 3 weeks of the first dose of anthrax spore vaccine. Salmonellosis give a wide variety of syndromes, which include primary and secondary salmonellosis, chronic and temporary carriers, latent and acute infections. All of them are right. The widely used method for diagnosis of leptospirosis is SAT or serum agglutination test. FAT and CFT are not widely used diagnostic techniques against leptospirosis. The most important portal of entry of leptospirosis is skin. The size of nodule of tuberculin test to be positive should be 5 mm. Q fever is frequently found in following materials of infected materials. Q fever agent is found in milk and urine, placenta and spleen, blood and sputum, means all the natural secretions and excretions. All the natural secretion and excretions. The laboratory animal of choice for rabies diagnosis is mouse. Mouse is used to diagnose the rabies in laboratory conditions. Cowpox protects against smallpox in humans, and it was demonstrated by Edward Jenner. Edward Jenner vaccinated a child against cowpox by injecting the cowpox agent into that to protect it against from the smallpox in 1798. In order to demonstrate fungi in tissues, the scrapings from lesions are warmed at 10% potassium hydroxide with AVO to dissolve or hydrolyze all of the components as carbohydrate, fat and proteins. To hydrolyze proteins and fats, to hydrolyze protein, fats and polysaccharide or carbohydrates. 10% carbohydrate hydroxide is used to dissolve all these three major constituents as carbohydrate, fat and proteins. And this method, the purpose of that is used to demonstrate the fungi. To demonstrate fungi, 10% potassium hydroxide is used. The approximate number of zoonoses as recognized by WHO is 150. There are 150 zoonotic diseases. The most important source of leptospirosis in man is dog and cattle. Dog is also vaccinated against leptospira along with distemper, herpes, etc. Leptospira has many strains as Harjo bovis, etc. Toxigenic strain of Staphylococcus aureus produce 5 different enterotoxins designated as A, B, C, D, and E. The following combination of toxins is responsible for majority of food poisoning cases. A and B, first two, as A and B are important for food poisoning. Among A, B, C, D, and E of Staphylococcus aureus, zoonosis is defined as which occur in With respect to EH requirements, cation anion redox reaction requirements for growth in food, anaerobic bacteria such as genus Clostridium requires negative oxidation reduction value. Hard water responsible for development of renal calculi, dyspepsia, and goiter. The growth of algae can be checked by adding copper sulfate at the rate of 2 to 10 pound per 10 lakh gallons of water. Adding copper sulfate at the rate of 2 to 10 pound per 10 lakh gallons. Success of contamination of water are due to industrial sources of contamination of water are from industrial sewage, agricultural pollution, and domestic sewage. The rotten egg smell is related with contamination with hydrogen disulfide H2S. Bacteria which contaminate the water are they all are the bacteria that can contaminate the water as iron bacteria, coliform bacteria, and soil bacteria. In the absence of microbial oxidation reaction will be organic matter will be converted to humic acid. Coliform bacteria are good indicator of presence of large in number. The coliform bacteria are present large in number. They are excreted in feces. They are easily detected, so they are used as indicator of polluted water. Viral diseases which are related with water pollution are all these are the viral diseases that can contaminate the water that are pollution that can contaminate the water as foot and mouth disease, canine distemper, and rinderpest virus. They all are present in virus, and they all are the viral diseases. Which microorganism is related with the purification of water? Algae is related with the purification of water. The India filter consists of which of the following? India filter is related with 4 earthen pots. High pressure filter are the pasture chamber, land filter, the Berkey field filter, and the Sudha microfilter. Sudha microfilter having cellulose membrane filter. Bacterial diseases related with polluted water is anthrax. Anthrax is present in water. Purification of water necessary for which of the following? Purification of water is necessary for removal of objectionable odor and turbidity. Purification of water is required for reduction of organic and inorganic matter to permissible level, and purification of water is necessary for removal of hardness and pathogenic microbes. Small scale purification related with the storage. Sun rays can penetrate up to 12 inches in the water. The milk of animal receiving attenuated live spore vaccine of anthrax should not be consumed for 15 to 30 days. The anthrax vaccine is made by the attenuated live spore vaccination of non-capsulated vaccine. Remember that non-capsulated bacteria. Remember that the capsulated bacteria are the pathogenic, and the non-capsulated anthrax bacteria is non-pathogenic. So the vaccine is made from non-capsulated anthrax bacteria. The guanine plus cytosine content of Clostridium DNA is intermediate as 23 to 43, not very less as 35 to 35 moles percent, not very much as 50 to 51 moles percent. It is intermediate of them as 23 to 43 moles percent. Concentration of guanine cytosine content of Clostridium DNA. DNA hybridization study reveal a close relationship between these two species of genus Streptococcus. Both faecalis are related as the Streptococcus faecalis and Streptococcus faecium. They are genetically related to each other. Which of the following scientists have shown Vibrio parahemolyticus to be agent of food poisoning? T. Fujino were the scientists who had shown that Vibrio parahemolyticus is the agent for food poisoning. Which of the following method is highly sensitive for staphylococcus for detection of staphylococcus enterotoxin in food. Radioimmunoassay is the most sensitive method for detection of staphylococcus enterotoxin in food. 1 gram of purified Clostridium botulinum toxin can furnish about 8 million lethal doses, or 80 lakh lethal doses. 80 lakh LD lethal doses denoted as LD50. So 1 gram of purified Clostridium botulinum toxin can have the 8 million LDs or the 80 lakh LDs. Profuse watery diarrhea without blood after consumption of contaminated food is an indicator of food poisoning by Campylobacter entridus. Campylobacter entridus causes the profuse watery diarrhea without blood. If we eat the contaminated food with Campylobacter entridus. Minimum concentration of aflatoxin in food to cause food poisoning is 30 parts per million or 30 mg per liter of the food, as parts per million is equal to milligram per liter. Antibiotics as feed additives are used to promote growth and better feed consumption, but still they should not be fed beyond certain age for this purpose. This limit as proposed by World Health Organization for calves is 3 months. There is also a reason for antibiotic resistance or very large number of concentration of antibiotics in these animals. So they are being discouraged by international organizations not to feed antibiotics to the animals as growth promoter. In rigor mortis of body, lactic acid concentration is increased by 10 to 20 times. In rigor mortis, lactic acid is increased 10 to 20 times. Bleeding time is in poultry is 2 minutes. Amount of blood obtained from cattle during slaughter is 30 pounds or approximately 10 liters. Remember that the blood in human is approximately 6 liters and that in cattle is 10 liters. Less bleeding occur in following method. In Jhatka method there is less bleeding. Jhatka method is the method of Sikh follow this method, in which there is whole of the head is cutted and including the vertebra is also incised, or which is the physical change in stored meat. The physical change in stored meat is shrinkage, less of bloom and sweating. Sweating means the removal of water from the meat, this term is known as sweating. Shrinkage and less of bloom is the physical change in stored meat. White spot on the surface of meat is due to Sporotrichus cornish. For medium sized abattoir, how much space is required? 2 to 4 acre land is required, and 1 acre there is 160 marla. So approximately 500 marla or 400 to 500 approximately 500 marla land is required for an abattoir, or in terms of acre it is 2 to 4 acres. Rate of cooling is slow in heavy carcass, so high temperature may persist in deep reseated musculature is known as bone taint. Bone taint is the condition that is for the less rate of that is due to the rate of cooling is slow in heavy carcass, so high temperature may persist in deep reseated musculature. The high temperature that persists in deep reseated musculature is known as the bone taint. Intestine of slaughtered meat animal is used for surgical sutures, casings and meat meal. On liver, following lymph node is found. Liver has the portal and hepatic lymph nodes. In sugarcane farming, human has a risk of following disease. Risk of leptospirosis. Leptospirosis involves the rats and they are present in water. So in sugarcane farming there is more water is there, so there is the chances that leptospira may be there that can infect the farmers. In 1957, due to importation of horse in India, African horse sickness entered India? Before 1957, there was no African horse sickness in India. Rat bite fever is caused by Streptobacillus moniliformis. Streptobacillus moniliformis cause the rat bite fever. Tick acts as vector in all of these as Q fever caused by Coxiella bornete, endemic relapsing fever, and toleremia. Flea act as vector for plague. Direct transmission of disease occur by droplet infection, physical contact, and contact with infected soil. All these are the sources of direct transmission of disease. Airborne infection is found in all of these as foot and mouth disease, tuberculosis, and influenza. They all are the airborne diseases. Disease transmitted by turtles and tortoises, all of them as Campylobacteriosis, Salmonellosis, and Edwardsiella torda. Edwardsiella torda, Salmonellosis, and Campylobacteriosis are transmitted by turtles and tortoise. Pig act as amplifier host for Japanese encephalitis. National Environmental Engineering Research Council of India is located at Nagpur. The size of droplet nuclei range between 1 to 10 microns. 1 to 10 microns is the size of the droplet of size of the nuclei of droplet. The amount of water required by animals depends on all of these as species and size of animal, season and functional activities of animal, and nature of fodder. How much moisture is in the fodder? More the moisture in fodder, less the water consumption, and less the water in fodder, more the water required. So animal fed on concentrate requires more water. Concentrate has more dry matter and less water, less moisture in concentrate. Choose the noise level where rupture of tympanic membrane occur at 160 decibels. The rupture of tympanic membrane occurs. Which immunoglobulin is found in milk? Colostrum. Immunoglobulin A is present in colostrum. Choose the milk-borne disease which belong to rickettsia group. Q fever caused by Coxiella bornete. Coxiella is a rickettsia, so it is also present in milk. In organoleptic test of milk, which is performed, color, flavor, and taste, all are the organoleptic test. In mastitis cow's milk, pH will be basic. Remember that the pH of normal milk is slightly acidic, slightly less than 7. Identify the sugar present in milk. Sugar of milk is lactose. Select the milk-borne viral disease. All are the milk-borne viral diseases as poliomyelitis, cowpox, and foot and mouth disease virus. Red color of milk is due to presence of Serratia mercensins. Serratia mercensins imparts red color to the milk. What type of bacteria is called liquefiers? Peptonizing or casein digesting bacteria. Peptonizing or casein digesting bacteria are called the liquefiers. Bacteria which produce no change in milk appearance, odor, or taste are called as inert bacteria. Non-inherent or artificial factor of antimicrobial action of milk is antibiotic and sanitizer. Antibiotic and sanitizer are the non-inherent or artificial factor of antimicrobial action of milk. Choose the milk-borne viral diseases which is transmitted when diseased human or milker is handling the milk. Poliomyelitis. Poliomyelitis is the virus or the disease that the humans transmit to the animals. Humans are the natural host for this virus, and they transmit from humans to animals. So bortreomycosis is caused by Staphylococcus aureus. Staphylococcus aureus is the most important causative agent of mastitis, and it also causes the bortreomycosis. Natural or apparent acidity of milk is 0.13 to 0.15%, as the natural milk is slightly acidic, so the percentage of acidity is 0.13 to 0.5% of natural or normal milk. Increased acidity of milk indicates that there is low heat stability. Meat is poor source of iron and vitamin C. Vitamin C is 3 times more in camel than that of cattle milk. Milk fat is more in which portion of milk drawn from the udder. Milk fat is more in the milk that is drawn from the last milk, and microbial load is maximum in the fore milk that is drawn from the udder. Fore milk has the maximum microbiological load, so it should not be consumed, and the last milk has the maximal fat content. Which type of adulteration is detected by Hansa test? Adulteration of cow milk in buffalo milk is cow and buffalo milk are differentially diagnosed or differentially tested or detected by the Hansa test. Yellow milk is due to all of above as cow's milk, alkaline milk, and Pseudomonas cinzantha. Pseudomonas cinzantha, alkaline, and cow's milk imparts yellow color to the milk. Which is the milk stain? Newman's stain or Newman's stain is the milk stain. True or false? We will discuss only the true. The first true is true or false. The rate of inactivation of virus is generally inverse with temperature above the freezing point. It means that more the temperature, less will be the virus inactivation. So the virus will be inactive at more temperature. As we increase the temperature, then activation is increased. So this is not a simple rule. There is also another factor, that is it is infected or it is affected by components of viral immediate environment such as food with its microflora and material. Example, feces, sewage in which the virus is suspended. So it simply is saying that virus is not only depending upon temperature, it also depends on its media. So if the virus is in its host, no matter how much temperature is of that host, the temperature you know that the host is approximately 37 degrees centigrade, so it multiplies here at optimal stage. So by our rule that we had said that more the temperature, less is the inactivation. So the host has more temperature but the virus is less inactive at that conditions because of the environment. The environment is providing it all of the necessities of life, as the enzymes and the nucleotides etc that is required for its survival. So the inactivation of virus do not depends only on temperature, it also depends on its host. If the host is supporting for its life, so its activation will not be less, no matter how much temperature is that, within a minor fluctuations. Within minor fluctuation, if the temperature is not favorable and the environment is favorable, then the virus too will be less inactive. Immune 304. Detection of virus in food may effectively be established on the basis of infectivity either in living host or in the cell culture. Simply the detection of virus in food may be effectively, virus can be detected either from the host or from the cell culture. So many cell lines are HeLa cell line, Vero cell lines. There are BHK, baby hamster, kidney cell lines. There are many cell lines on which we can detect the virus, or we can detect the virus by directly injecting it into the host. Sternispore vaccine is prepared from non-encapsulating a virulent strain of Bacillus anthracis. Entero 308. Enteroviruses consists of RNA. 310. Complon is unit of complementation and opron is unit of operation. Zoonoses are defined as which are transmitted between vertebrates. Primary classification based on which of the following? Primary classification is based on life cycle of infectious agent. More than one vertebrate host are found in cyclic life cycle. Non-animal developmental site is found in saprozoonosis. Sapro means decaying, dead or decaying, so saprozoonosis is non-animal development site. Classification of zoonosis is as and nature of life cycle of microorganism, nature of reservoir host, and based on group of animal which transmitted the disease or which transmits the disease. Which of the following scientists gave the theory of ptomaine poisoning to explain illness contracted by eating certain foods? Francesco Celmi has given the theory of ptomaine poisoning to explain illness contracted by eating certain foods. Example of amphizonosis is staphylococcosis and streptococcosis. Term anthraconosis was given by Wegener. Infectious agent require one vertebrate host is called as direct. Principal host of Trichinella spiralis is pig and man. Cystidiasis is an example of cyclozoonosis. In metazoonosis, require one vertebrate host, and in paragnomosis, it requires two invertebrate hosts. One vertebrate host in metazoonosis and two invertebrate hosts in paragonomiasis. Transovariant transmission occur in looping ill. In saprozoonosis are histoplasmosis, botulism, and encyclostomosis. Erysipelas are related to it is occupational disease, zoonotic disease, and it is the disease of pig. Monkey is related with the disease of KFD, Venezuelan equine encephalomyelitis, and dengue fever. Complete removal of infectious agent is eradication. Prevention includes all of above as environmental hygiene, chemoprophylaxis, and immunization. The first station of animal quarantine are in Marsilius at 1383. Quarantine means isolation of new animal, isolation of host, and isolation of import animal. Quarantine is done for which disease? It is done for yellow fever, smallpox, houseborne typhus, all of these diseases. Quarantine for cattle is done for 90 days or 3 months. Imported sheep and swine is quarantine for half month or 15 days. Use of quarantine in public health has been done chiefly at all above as at international level, at local level, and at the interstate level. Resistance provided by to animal by immunization. Resistance is provided to animal by immunization. Use of chemical is done under chemoprophylaxis. Veterinary public health are devoted to the application of professional skill, knowledge, and resources. Sources of contamination of milk by all of above as infection of milk directly from the cow, infection from man to cow and then to milk directly by human being. Milk is defined as milk obtained except within 15 days before or after 5 days of calving. Within the 15 days after calving is the colostrum. Disease transmitted from man to cow is sore throat and scarlet fever. Sterilization of milk is done at 111 degrees centigrade for 25 to 30 minutes. It is not true. I think it is not true. That much high temperature is not for that high time. Qualities of sterilized milk. I think sterilization 72 degrees centigrade for 15 seconds is pasteurization. 72 degrees centigrade for 15 seconds is pasteurization, and sterilization is 111 degrees centigrade for 25 to 30 minutes. Qualities of sterilized milk are all of above as increased keeping quality, free from all microbes, and no cream layer is found. Loss of nutrient in sterilized milk is 50% of vitamin C and 33% of vitamin B. Pasteurization means 72 degrees centigrade for 15 seconds. The change produced by acid forming bacteria is all of above as bacteria ferment lactose by forming lactic acid formation so that the pH of milk is decreased, becomes acidic. Sour odor and taste and curdling of milk. Most of the gas forming bacteria belong to Collyaerogenous family or Collyaerogenous group are the mostly gas forming bacteria. Milk quality is destroyed by gas producing bacteria, acid producing bacteria, and liquefiers. Red color of milk produces by Serratia marcescens. According to PFA rule, toned milk should contain at least 3% fat and 8.5% solid not fat. Double toned milk contains 1.5% fat and 9% solid not fat. Buffalo milk contains fat, it has more fat, it has 6.6% fat. The usual cause of spontaneous curdling is Streptococcus lactis. Milk hygiene is related with milker, animal, and utensils. Which virus is related to milk spoilage? All of these as FMD, cowpox, and rabies. Standard plate counting of 2 lakh bacteria per ml of milk grade is very good. The common milk bacteria is grown at 20 to 40 degrees centigrade. Inert bacteria produces no change in appearance, odor, taste, or reaction in milk. Pseudomonas cinzantha produces yellow color in milk. Thread-like masses which produce generally by spore formation are mold and yeast. Mold and yeast are the thread-like masses which reproduce generally by spore formation. Psychrophiles are Achromobacter, Aerobacter, and Pseudomonas. Psychrophiles are the Achromobacter, Aerobacter, and Pseudomonas. Cercarial dermatitis is trematode zoonosis. COV test result with which of the following? With all of the above as suitability for heat processing, increase skipping quality, and to determine the developed acidity by a Cobb test. The pH of milk has 6.6 to 6.8 pH, slightly acidic. Normal milk. No flakes in milk having acidity is about 0.1%. No milks in milk having acidity of 0.14%. Freshly drawn milk should be cooled at -5 degrees centigrade. Yeast and molds related with milk pollution is Tarula and Monilia. National agency related with quality control of milk is PFA, ISI, BSI, and AgMark. They are Indian related. Question: international agency related with quality and control of milk is all of above as IDF, alpha, etc. The natural or apparent acidity of milk is 0.13 to 0.14%. Germicidal property of milk is due to all of above as immunoglobulins, complements, and bifidus factor. Non-specific factor of germicidal property of milk is lactoferrins. Lactoferrins are the non-specific factor of germicidal property of milk. Chief immunoglobulin of milk is IgA. Which of the following? Diacetyl catalase and lactic acid are the microbial metabolites that can be used as spoilage predictors. Diacetyl catalase and lactic acid. Germicidal factor which squeeze out iron from media or milk is lactoferrin. Lactoferrin is the germicidal factor which squeeze out iron from media or milk. In methyl blue reduction test, MBRT test, the milk sample reduce in 15 minutes. Grade will be very bad. Adulteration in milk is due to which of the following? All of above as addition of water, addition of thickening agent, addition of coloring agent. They are all responsible for adulteration of milk. Preserving of milk is due to all of above as to prolong the period of sweetness, to inhibit the bacteria, to increase keeping quality. Pure milk should be colorless, odorless, and free from turbidity. Main source of water supply are rain, underground water, surface water. All are the main sources of water supply. Which source is not described as underground water? Tanks are not the groundwater, whereas deep water, springs, and shallow water are the underground water sources. Rainwater is Clear, bright, soft in nature and has good insipid taste. Is soft in nature and it contains few traces of dissolved solid. Surface water contains organic matter, excreta of human and animals, and objectionable mineral and poisonous products. Underground water is usually free from pathogenic microbes, usually free from impurities, and requires no treatment. A deep well is which is present below the first impervious layer in the ground. Hardness is due to presence of calcium carbonate, magnesium carbonate, calcium sulfate, magnesium sulfate, calcium chloride, magnesium chloride. Any of these can be responsible for the hardness of water. Calcium carbonate, magnesium carbonate, calcium sulfate, magnesium sulfate, calcium carbon chloride, magnesium chloride. Presence of iron in water indicate bitter taste. Presence of iron in water indicates bitter taste. Bacteria which abstracting iron from the water are Golionella and Crenothrix. Golionella and Crenothrix are the bacteria which abstract iron from water. Arsenic pollution in water indicates industrial pollution. Ammonia convert to nitrates due to which bacteria? Due to Nitrosomonas. Nitrosomonas are the bacteria which convert, in which ammonia is converted to nitrates. Groundwater which is below the first impervious layer. Groundwater is which is below the first impervious layer, which is the immediate test and can be conducted in the field. Physical test can be conducted in the field as color, taste, etc. Odor of the sewage is due to hydrogen disulfate, and the H2S smell is just like of the sewage water or sewage. Soft water have soft and insipid taste. Taste is of soft water. Organic matter when present in water gives an alarming indication. Is contamination with sewage water, contamination with carcass, and contamination with vegetation. These are due to the organic matter is present in water that gives alarming condition of that our water is contaminated with sewage water, carcass, or the vegetation. Saprophytic bacteria multiply at 20 to 22 degrees centigrade. The pH of water in which of the following pH of water is usually slightly acidic to slightly basic, as 6.5 to 8.5. Spoilage of canned food can be judged by observing blotting at the end of tins. Blotting at the ends of tins are the indicator of spoilage of canned food. Diarrhea in humans and score in pig is due to water contaminated with sulfate. Deficiency of fluorine in drinking water is related to dental caries. Which of the following bacteria is the most common inhabitant of human nasal tract? Staphylococcus aureus. Staph aureus is the most commonly present in human nasal tract and is the main cause of mastitis. With respect to EH requirement for growth in food, anaerobic bacteria such as the genus Clostridium requires negative EH value.